Welcome to USMLE World, where we ask, answer, and explain USMLE questions. Today, we're diving into Step 2, Internal Medicine, focusing on endocrine, diabetes, and metabolism. Let's get started with question number 9. For the following case, which of the following metabolic conversions is most likely contributing to this patient's current condition? A. Galactitol to tagatose. B. Galactose to galactitol. C. Glucose to sorbitol. D. Glucose 6-phosphate to 6-phosphogluconolactone. E. Pyruvate to lactate. The case scenario is: a 56-year-old man is evaluated for progressive visual impairment. The patient works as part of the grounds crew at an airport and says he has trouble identifying aircraft at a distance and with filling out paperwork at the end of his shift. His medical history includes poorly controlled diabetes mellitus, hypertension, and gout. A year ago, the patient underwent an uncomplicated repair of a right inguinal hernia. Physical examination shows bilateral clouding of the lens. The remainder of the examination is unremarkable. The question is, which of the following metabolic conversions is most likely contributing to this patient's current condition? Your options are: A. Galactitol to tagatose. B. Galactose to galactitol. C. Glucose to sorbitol. D. Glucose 6-phosphate to 6-phosphogluconolactone. E. Pyruvate to lactate. You have 15 seconds to type your answer in the comment box. Congratulations if your answer is C, which is glucose to sorbitol. This question is designed with the focus to assess your ability to apply foundational science concepts. This patient has cataracts, an opacification of the lens of the eye that can lead to blindness, likely a result of long-standing hyperglycemia due to poorly controlled diabetes mellitus. Certain cells, example retinal endothelial lens, renal mesangial and Schwann cells, are more vulnerable to hyperglycemia-induced damage because they are unable to regulate glucose transport when circulating levels are high. Multiple metabolic pathways are involved in the pathogenesis of hyperglycemia-induced tissue damage. Advanced glycosylation end products. Glucose can non-enzymatically attach to proteins and lipids, forming reversible glycosylation products that slowly stabilize into irreversible products. Under hyperglycemic conditions, advanced glycosylation end products accumulate and facilitate deposition of LDL in blood vessel walls and inflammatory cell invasion that causes atherosclerosis and microangiopathic complications. High glucose levels in the aqueous humor may also induce non-enzymatic glycation of lens proteins, which contributes to cataract formation. In polyol pathway overactivity, the enzyme aldose reductase converts glucose to sorbitol, which is then oxidized to fructose by the enzyme sorbitol dehydrogenase. With hyperglycemia, formation of sorbitol occurs faster than its metabolism to fructose, resulting in its accumulation. Sorbitol increases the osmotic pressure in tissues, which will stimulate the influx of water, leading to osmotic cellular injury. In addition, oxidative stress can also result from the depletion of NADPH. Since aldose reductase consumes it, it also contributes to cataract formation and other diabetic complications such as retinopathy, peripheral neuropathy, and nephropathy. If you choose any option other than C, you are wrong. Let's briefly discuss the other options. Both choice A and choice B are wrong because aldose reductase also catalyzes the conversion of galactose, which is obtained from dietary lactose, to galactitol, but sorbitol dehydrogenase is incapable of oxidizing galactitol to its corresponding keto sugar, which is tagatose, a food sweetener. In galactosemia, galactose 1-phosphatidyl transferase deficiency, excess galactitol is produced, which causes cataracts in newborns. Choice D is wrong because in the hexose monophosphate shunt, glucose 6-phosphate is converted to 6-phosphogluconolactone by the enzyme glucose 6-phosphodehydrogenase, generating the reducing equivalent of NADPH. G6PD deficiency results in hemolytic anemia during times of increased oxidative stress. Choice E is wrong because lactate dehydrogenase catalyzes the conversion of pyruvate to lactate under anaerobic conditions. Excess lactate forms in hypoxic states, causing metabolic acidosis. Your take-home message from this question is that in hyperglycemic states, aldose reductase converts glucose to sorbitol at a rate faster than sorbitol can be metabolized. Sorbitol accumulates in certain cells such as lens cells, causing an influx of water and resulting in osmotic cellular injury. Depletion of NADPH by aldose reductase also increases oxidative stress, which accelerates development of cataracts and diabetic microvascular complications like neuropathy and retinopathy. Did you get the answer? Only click above to move on to the next question if you have the answer correct. If, however, you are unable to accurately respond, you must watch this episode once more. Recall that comprehension is essential for advancement. Unlock the secret to acing your medical exams, especially the USMLE, with our top-notch resources. Ensure you and your friends are well prepared by hitting that like button, sharing this wealth of knowledge, and subscribing to our channel. Remember, your success is just a click away.